I think one of the exciting initiatives that we're embarking on is to have a center that will focus on suicide prevention and research. Suicide has received a lot of attention in the media of late. Certainly there's a concern. We see nationally a trend, an increasing trend in child and adolescent suicide. And certainly we have felt that locally. For many years we had between 1 and 3 suicides for children and adolescents. And then a couple of years ago in 2012 we saw a jump to 7 children and adolescents in 1 year. In 2014 we saw that number jump to 14, which is a significant concern. We're not sure why there has been an increase. We don't know if it's a one-time increase or if this is a relatively short-term concern, but our fear is that this is something more pervasive that's going on and that we will continue to see elevated numbers. So one suicide has a tremendous impact, not just to the family because of the loss of the victim, but it resonates through everyone who had any contact with that child, teachers, friends, teammates. But we also know that when any given adolescent takes their own life, it elevates the risk of additional suicides. Technically we call that suicide contagion, and that's particularly the case in an adolescent population. So this is something that we really need to get hold of and get ahead of. One loss to suicide is too much. 14, it's hard to conceive of the impact that could have. Nationally, suicide is now the second leading cause of death for children and adolescents. The leading cause is accidental death. But if you take deaths from cancer, respiratory conditions, heart conditions, medical conditions like diabetes, and you combine them all, you still have more deaths by suicide. So it's a big problem, something that something that the hospital is committed to addressing, not just in Franklin County, but in the region. There's certainly an imbalance in funding from a research perspective. There's a lot more funding that goes to pediatric cancer than to pediatric suicide, even though we're losing way more kids to pediatric suicide. In terms of providing services, clinical services in the behavioral health field to children and adolescents, services for children who've already been identified as being depressed or being predisposed to suicide or being in crisis for some other reason. Funding is there, whether it's through Medicaid or private insurance. There is very little funding available for prevention efforts, and there is a lot of evidence to suggest that if you choose the correct prevention interventions, you will end up saving money down the line and improving behavioral health and physical health outcomes for children and adolescents as they move into adulthood.